Yeah, better.
All right, okay. Good afternoon, lovely mommies and daddies. All right, I'm Dr. Goh, your friendly neighborhood child specialist. So this is my second talk actually. The last one was given last time. So this one I'm going to talk about something that many people try to avoid because it might not sound very nice. Okay, but it's very important. All right, we're going to talk about babies' poos and pees. Okay, so what should we see? So I've divided my talk into two sections. The first section will be the poos. We will talk about the colors, consistency, the frequency, and also what are the warning signs. Now, the second one, of course, will be the baby's pee, the urine. So the same thing, we're going to talk about the colors, the frequency, the urine stream, and what to do when your baby doesn't pass urine during the first day. All right. So let's go to the first one, baby's poo. Now, first of all, we want to talk about the newborn poo, the purest poo, the purest of all poo. It's also known as the meconium. It is black, greenish dark. It is very sticky and it has no smell. And it's sterile actually. There is no bacteria. It's very clean. And what is it actually? Why is it so dark and sticky? It actually contains, actually it's your baby's poo during the whole 9 months of pregnancy. Whatever your baby swallow inside the womb, the amniotic fluids, the mucus, your intestinal cell linings, and all the substances that your baby swallow and keep it for 9 months. And this is what you get, meconium. So once again, there is another picture. It is dark greenish. There is no smell at all. So if your newborn passes this kind of black stools, just don't be surprised. It's actually normal. Your baby should be passing this kind of poo. Okay. And one of the common complaints that the parents will ask is, how do I wash it? It's very sticky. I can't just wash it with water. Yeah, you're right. There is no way you can wash it with water or soap. Usually we use some baby oil-based products, like Johnson & Johnson, like this one is a baby oil, any form of baby oil, or you even use olive oil in certain places. Okay. Now the next thing we are going to talk about the color of the poo. So as you can see here, there are many poos with different colors and also different expressions. So which color we like, and which types of poo that we don't like. Now you can see the black poo, the white poo, and the red poo. They don't seem to be very happy. So in fact, these are the colors that you have to watch out. All right. And you can see at the top there is a yellow mustard flavor poo, which is yellow in color. This is the one that everyone likes the most. All right. You want your baby to have this kind of poo. Okay. Now dark green and green is totally normal. Okay, next. So we're going to talk about happy poo, the poo that makes us all happy. Now, if your baby is passing this kind of poo, yellow, on the left is a yellow, creamy like a poo, which is commonly seen in a breastfed baby, and on your left is a greenish kind of poo. So these kind of poos are healthy poo. All right, and we shall go to the next one. Now the sad poo, a poo that makes all of us anxious and worry. As you can see, our little poo here is wearing a red shirt and also a red balloon. So you can expect, if you see a poo with red color, it's not a good sign. All right, it's usually due to bleeding. Okay, and on the right side, there is a poo that is pale in color. It's almost like white color. This is called a pale stool. When you get this kind of stool, you need to be very careful, okay? Because it's not, it's a danger sign actually. Now we're going to talk about the poo family. It's a lovely family with different characters and colors. So how do you actually classify the poos and describe the poos. All right. So sometimes when I ask my parents, oh, mommy, your baby has diarrhea, your baby passes motion. So can you just explain how does it look like? So mommy will say, macam tu lah, berak macam tu lah. Saya pun tak pasti. Okay, so there is actually a stool chart. It's called a Bristol stool chart. It's like a universal language that everyone talks. We speak in the same language. Okay, so to make everyone understand, they actually come up with a lot of metaphor and for you to remember. So, and most of it, they actually use our human foot to describe the poo. Okay, so sorry about this. So, as you can see here, there are 7 types of poo. Type 1 is like a rabbit dropping. All right. Type 2, they call it a bunch of grapes. Type 3, a corn on cobs. Type 4 is a sausage. Type 5, like chicken nuggets. Type 6, porridge. And type 7 is basically a gravy kind of poo. So I think it's very important for us to learn this so that you can describe and you can tell your doctors, so we can understand how we can roughly gauge what is your baby having, whether your baby has diarrhea or constipation. Okay, so we're going to go through that. Okay, the first type of poo is called a rabbit stool. All right, it's small and it's hard, and some even call it the goat's poo. All right, tahi kambing. And the second type is this kind of food. So that is actually a real picture of the type 2 poo. I'm so sorry. Okay, I think everyone just had your lunch. But sorry, just because I have to let you understand how does it look like. And they also they call it a bunch of grapes. All right. So whenever you have type 1 and type 2, your child is actually having constipation. Okay. Now type 3 and type 4 are basically normal poo with normal consistency, and they describe type 3 as a sausage-like poo with cracks. Okay, this is how it looks like, or some call it a corn on cobs. So whoever had corn on cobs just now, I'm sorry. And the next one will be a sausage type of poo. Okay, this is the poo that everyone wants. Okay, it's smooth like a sausage. It's soft. It's easy to pass out, and your baby, you want your baby to pass this kind of poo every day. Okay, so type 5 is called chicken nugget poo. It's soft blobs with clear-cut edges. It's basically soft, but it still maintains the solid form, and it's very easily passed out. So I would say that this is in between a normal poo consistency to a diarrhea. Okay, so when your child starts to have this kind of poo, then you can probably have to monitor and make sure that it doesn't get more watery. Okay, so chicken nuggets. Now next one is porridge. This is definitely a diarrhea. Okay, fluffy pieces with ragged edges, a mushy stew. So it's like a brown porridge. Okay, yeah, when the baby has this, means like more than 3 times of this kind of stew, and this probably tells you that your child is starting to have diarrhea. Now the next one is a gravy-like kind of food. This is a type 7. This one, no-brainer, it's definitely a diarrhea. Okay, it's watery. You don't see pieces of the stew. It's entirely liquid. Yeah, this is a gravy. I don't know what gravy is that. Whether is it a KFC gravy? Not very sure. But this is a picture of a real poo. Your baby is having this diarrhea. Okay. So yeah, we try to not show a real picture. Instead, we try to use something. Some food that we see every day to let you remember. So once again, this is another way of remembering it. Type 1 is like our chocolate balls, separated hard lumps like a nut, and second one will be like a sausage-like but lumpy kind of poo. So these two are constipated poos, all right? And type 3 and type 4 are the normal poo. Okay, type 5. In between normal to diarrhea, and type 6 is like a mushy one, like a porridge or cream, and type 7 is like a gravy. All right, so everyone is clear at the moment. Okay, now the next consistency. When you, the first thing is to see the color, and then to see the forms, the shapes, and next, the consistency. Feel it with your hand. I'm just joking, you don't really have to feel it. Okay, so this is a healthy breast-fed poo. It's yellowish and greenish. It's mushy and creamy. And usually breastfed poo are quite, they have a sweet smell. It smells actually quite nice compared to the adult poo. Yeah, it's like a yellow mustard. If you still remember the first picture that I showed you, yellow mustard kind of color, and it's usually watery. So a lot of parents, they actually ask, oh, doctor, I'm breastfeeding my child. My child has this kind of a very mushy stool. Is it normal? Yes, it's definitely normal. Okay. Whereas a formula-fed baby, their poo is going to be a little bit more less runny, less watery. Okay, and it's almost similar to the texture of a peanut butter, and the color could be tan brown, yellow brown, or green brown. So it's like a peanut butter over here. All right. So if you see compare with the breastfed poo, the breastfed poo is more runny and watery, but the formula-fed poo is a bit more mushy. Okay. So this is a solid food poo. So when your baby starts to take some solids after 7 months, after weaning, you'll get this kind of thicker but still mushy kind of poo, and the colors also change to a bit more dark. It becomes brown and dark brown, and it's usually smellier. So sometimes it also contains undigested food. Okay. Now this is a poo with partially digested food. It usually happens when your child is already started eating diet. So you already started porridge, you introduce carrots and broccoli, other things. You can often see the chunks of the food. And this is normal because the baby is still trying to learn how to chew, and also the baby starts to develop some teeth to actually chew the food. So that's normal, don't worry about this. This is type 1 poo, everyone knows. It's like a chocolate ball. It's hard pebbles. Usually happens when you introduce solid food, like you started to give your babies rice or crackers, something. And it can also signify dehydration. All right, the baby doesn't drink enough milk or water. Your baby may have this kind of a hard stool. And as you know that when your baby has hard stool, constipated, they may strain, and at the end they may have some injuries to their rectum, and they may have blood. Now this is a dark green or black poo. Okay. If some parents, they probably remember this, when your baby has anemia, doctor started on iron supplements, and you see this kind of poo immediately after the supplements. All right, so don't worry, this is normal because of the iron, and it's usually dark green, and the whole poo is dark. Sometimes when you breastfeed your child with the method might not be correct, so you might have sore nipples and cracked nipples. The baby might actually swallow the blood from the cracked nipples, so they may have some dark poo, but usually it is not so much. Okay. Now, poo with mucus. It's slimy. It's commonly seen after your baby develops some upper respiratory tract infections or pneumonia. Yeah, most of the time the children do not know how to cough out their phlegm, so they will just swallow. So just imagine the phlegm that is swallowed will go into the intestine, and the bacteria will start to infect the intestine, and this is what you get, mucus. All right, it's shiny and glistening strings. It usually signifies infection, or it could be due to some allergy. Okay, so this is very important. I'm sure that everyone knows this. Okay, Red Notice is one of the box office movies in Netflix recently by The Rock and our Wonder Woman, and also Deadpool. So the Red Notice, remember when you remember this poster, when you see the pool with these three colors, black color, you're The Rock, red color, Wonder Woman, and white color, Ryan Reynolds, your Deadpool, it shows that danger is imminent. So black color, we call this a black tarry pool or MALENA. we describe this as, you know, the black tar on the road. It's very dark and it has a very particular smell. I think most of the time only the healthcare workers will notice it. So it's a sign of bleeding inside the gut, and usually in the upper intestines. So for example, your stomach, if you have an ulcer in your stomach, or the first part of your intestine, your duodenum, you may have blood over there, and it's oxidized and digested, and it becomes black. So by the time your child or the patient pass out the stool, it becomes this color, black tarry. So when you see this kind of stool, regardless of the age, your babies, of course not the newborn poo, not Meconium. This one is black. Sometimes you see blood. Regardless of the age, old people, middle age, or child, when you see this poo, immediately please seek for a doctor's help. All right, this is a dangerous sign. Okay, I'm going to repeat again. A black tarry poo, also known as the MALENA. I'm not sure why is it called MALENA. All right, it is a dangerous sign. Okay, it signifies a bleeding in the upper portion of the gut. You need to see the doctor immediately. Okay, all right. It could be because of ulcer or any internal bleeding in the upper part of the intestine. All right. In adults, the geriatrics, the old people, it's very common for them to have a peptic ulcer inside the stomach, where they pass out this kind of black tarry stool. All right. So remember this. This is the first one, the rock with MALENA. Okay, next is Gal Gadot, our Wonder Woman. It's a pool with bright red blood. Okay, this is yeah. When you see pool with this blood streaks, and the picture on the left, you can see some mucus, and it's blood streaks. This is almost because of infection. All right. Now, on the second picture, you see you see blood, but it's not really mixed with the stool. Okay, so what are possible causes? It could be because of wounds around your baby's anus. We call it the perianal fissures. Commonly happen after you have a prolonged period of constipation. All right, because constipation, when you strain, you stretch the rectum, then it's going to crack. So every time your baby passes motion, it's going to bleed a little bit. Same goes to adults. All right. Or sometimes when they have diarrhea, they have a very bad excoriation over their buttocks or perianal region. You may have blood as well. All right. So on the first picture, it's due to infection, or we call as dysentery. Dysentery is a bloody diarrhea, a diarrhea with blood. It is almost due to infections. All right. So like E. coli, salmonella, many types of infections can cause dysentery. Okay. Another one will be withdrawal bleed, which later I will talk about. It's because of maternal hormones. All right. So there's another picture of the pool mixed with blood. All right. Second picture is the excoriation. Sometimes it can be worse than this kind of picture. Okay. And the last one is the bacteria. Okay. This is the gram-negative rot. This kind of bacteria usually lives inside the intestine and infects you and will cause diarrhea. All right. So perianal fissure as one of the causes of the bleeding. So as you can see, this is the anus of the baby. You can see at 12 o'clock. So this is usually how doctors describe the pool. Okay, we describe them by the hours of the clock. Right. So for this one, you can see 12 o'clock. So this is the top part will be the genital, and the bottom part will be the butt cheeks. All right. You can see there is a skin tag over here, and there is the anal fissure. Okay, anal fissure is basically when your anus, which is this, your anus is usually very delicate, soft, but when you have constipation, it's going to stretch. When you strain, it stretches and it causes the cracks. So every time when the stool is hard, is going through the anus, it's going to crack even more. Okay, so usually it comes with a few 12 o'clock, 6 o'clock. Okay, there is no particular hours of the location. Okay, but this is usually how we describe it, and you can actually examine your child. Okay, this is another picture. This is our rectum, the anal canal. So the anal fissures not only can happen outside the anus, which we call a perianal region, it can also happen inside the anus, in the rectum. Okay, so this kind of situation, you will get a poo, a very constipated poo, hard poo with some blood streaks on top. Okay, and we can't examine that because it's inside. So roughly, we need to elicit the history of constipation. Okay. So again, this is another picture. This is perianal region, perianal fissures at 6 o'clock. All right. So this is very important for all parents. Okay, it's applicable to infants, neonates, and even pediatric age group. The vicious cycle of perianal fissure and the hard stool. Okay, so what happens when you have constipation? Your stools become very hard. Okay, not enough water. It is not lubricated. Okay, so what happens? You strain. You sit on the potty. Your baby sits on the potty. Strain, sit there for 15 minutes. Start crying, and your rectum starts to stretch. So when you stretch, it will crack. So once it will crack, it's going to form fissures. And the next time when your baby poo, your baby is going to feel the pain. The baby is going to cry during the process of passing motion. So what will your baby do, or your child? They will refrain from passing motion. That's why you can see a lot of patients actually come to us with constipated pools and even passing out blood. This is the usual history. Mommy will say that, oh, my child usually has constipation, passes motion about once every 2 to 3 days and stays very long in the toilet, 15 to 20 minutes. And I don't know why my child just refuses to go to the toilet. So most of the time, when you check the anus, you get fissures. All right. So this is a vicious cycle, which we need to break the vicious cycle. If they refrain from going to the toilet, they are going to get more constipated stool. They are going to have more pain when they are forced to pass out the stool, and they're going to have pain and they refrain from toilet. So it goes round and round and round and round. Okay, it's a never-ending story. So we need to stop this from happening. So whenever your baby has fissures or excoriation, try not to use baby wipes. Okay, even though baby wipes, if you want to use baby wipes, find those with no alcohols or parabens. But if this kind of situation happens where your baby already have wounds or superficial excoriation of over the butt cheeks, try not to use the wipes. Okay, use cotton instead. All right, cotton with a bowl of water. Just dip the cotton inside the bowl and wipe it, throw away, wipe it, throw away, wipe it, throw away. And after that, once it's clean, apply healing cream. So the healing cream in the government hospital, they will give you zinc oxide. But if you want to buy it outside, you can buy it. There are certain famous brands out there like Pseudo Cream or Bepanthen. They are good stuff. Right? Some other brands are almost similar. Okay, so you can find for yourself. Right? So the principle is be gentle to the injured, delicate butt cheeks and also the anus. All right. And of course, bring your baby to the doctors because we need to clear the hard stools. There are methods we clear. It's either we drink a laxative or we give Raven enema to actually soften the stool at the rectum. Yeah, so that will be another topic. Okay. Now the third dangerous sign will be a pale stool. If you still remember the 3 pictures in the red notice, the rock, the black one, Gal Gadot, our Wonder Woman, which is the red one, and our Deadpool, Ryan Reynolds, was wearing the white coat. So pale stool, should we be worried? Yes. Answer is yes, yes, yes. When you see a white stool, please run to the clinic. I don't care whether is it at night or not. Please bring to hospital. Okay, it is a warning sign. So why are we so worried about the pale stool? It's because of this condition. It's called biliary atresia. So let me just explain. Why is our poo yellowish, greenish, or black? It's because of bile or hempedu. Okay. So what is this? The bile is actually produced by our liver. Okay. So from the liver, it's going to go through all the biliary duct and it's kept inside the gallbladder. So whenever we eat, food comes into our stomach and the gallbladder will contract and it will force the bile down to the intestine and will mix with the food Yeah, it will try to digest the food together. And this bowel is actually responsible for the color of your stool. Okay, that's why baby's pool are yellow, greenish, or even dark brownish. So what happened in this biliary atresia? Biliary means the biliary tract is the hempedu, saluran hempedu, okay, to carry the bowel duct, to carry the bowel. Atresia means absent of a part of the body. Okay, so biliary atresia means that they are born without the tubes. The saluran hempedu tak ada. Okay, so is this an emergency? Yes. When you diagnose this is an emergency. You need to do operation fast. Okay, so this is another picture. Sometimes it's not only absent. Sometimes it can be due to strictures over the bowel ducts. Okay, and what is the commonest presentation of this? It is prolonged jaundice. That is the reason why babies who are jaundiced, we always monitor them up to 14 days, and 14 days for a term baby, 21 days for a prime baby. And if they are still jaundiced after that, we need to make sure that your baby does not have this kind of condition. Okay, so the jaundice is also known as the bilirubin. It has two parts. When we take a blood, we send to the lab, there are two portions. Number one is an indirect jaundice, which is a yellow pigmentation that happens, that is being carried inside your bloodstream. Another type is called a direct bilirubin, which is the pigmentation, the bilirubin that is found in your liver. All right. So when you have this biliary atresia, not only you are going to have a liver injury, you're also going to have the direct bilirubin component skyrocketing. Okay. So sometimes we call this as an obstructive jaundice. So when you have this condition, please consult your doctor immediately. If you see a pill stool, go see a doctor. You need to get this diagnosis. If it's confirmed biliary atresia, you need to do a corrective surgery within 60 days, or the procedure we call as a Kasai procedure. Okay, so just remember this. And this is a stool chart that usually doctors will show you. What is the color of your stool? So on the top, there are three colors. They are all pale. These are abnormal stools, or we call them a pale stool. The ones at the bottom, yellowish, golden, green, they are normal stool. Okay. Okay, so if your baby do not poo within the first day, should you be worried? Answer is yes. Okay, there is a reason why doctors and nurses, they will keep your baby for 24 hours or earlier if your baby to monitor your baby to poo and pee. The reason that the reason that we keep a baby is because there are certain conditions that will cause a baby not to be able to poo within the first 24 hours of life, which is this. It's called a HIRSCHSPRUNG'S disease. Okay, so our intestines are actually like a snake. There is a peristalsis, it contracts, relax, okay, it's going to push the foot from one side to the other side. Okay, so how does it move? It needs to have nerve cells, saraf. Okay, so even intestines have saraf. So what happens is, in this HIRSCHSPRUNG'S disease, a portion of the intestines do not have nerves. So what will happen? So the food will just go from this side, the food will be pushed to the other side. Oh, over this side, there is no peristalsis, so the food will just stuck here, and the intestine will become dilated. All right, so you can see the picture over here. Okay, so in this condition, HIRSCHSPRUNG'S disease, the nerve cells are missing in a portion of the intestine, usually at the large intestines or near the rectum. Okay, so the stool cannot be moved, so it causes obstruction. They can have abdominal distension, not passing motion. So one of the presentation is they don't pass motion within the first 24 hours of life. Okay, so it's also commonly seen in children with Down syndrome. It's an association. All right. So as you can see, this is a picture of a patient with HIRSCHSPRUNG'S disease. Okay, you can see the ileum is very diluted. All right. Now, go on to the next topic. I hope everyone is still with me. Okay. So we're going to talk about the pee. All right. If you have a boy and your boy can pee this far and even land on you, your boy pee on you, you should be grateful. Okay. Because if your boy doesn't have good strength, this is a warning sign. So we're going to talk about the frequency. So a lot of parents will ask, doctor, how do I know how many times the baby should poo or pee? As a rule of thumb, this is easy for you to remember. Day 1, poo 1 time, pee 1 time. Day 2, 2 times. Day 3, 3 times. Day 4, 4 times. Day 5, and 5 times. So after day 5, your baby should be passing motion and at least about more than 3 times, 3 to 5 times. And your baby should be passing urine about more than 5 times a day. So what I mean is 5 times a day means that you change your diapers, you change baby's diapers at least 5 times a day, and each diaper change should be fully soaked. Okay, ideally it should be fully soaked. So a lot of parents, they change the diapers very frequent. Baby pee a little bit, they change. So you have to roughly gauge how much your baby actually passes out urine. Okay, the best way, the most objective way is actually to measure, to weigh the diapers. Or it's not as a rough guideline, you would just change the diapers at least 5 times, fully soaked heavy diapers. All right, this will show that your baby has adequate hydration. Okay. Now the color. Okay, during the first day of life, the baby's kidney are not mature yet. They are not activated. All right, so about after 12 hours, your baby starts to pass out a bit of urine, and it's usually more concentrated. So it's a bit reddish in yellow, reddish in orange in color. And after that, by day 2 to day 5, it slowly becomes less and less reddish and becomes the yellowish or clear urine. Okay, there are some conditions that parents always ask. The first one will be a urate crystal. So if during the first few days of life, if you notice your baby has this kind of orange or red color, crystallized kind of material in your diaper, don't be worried. Okay, don't be afraid. This is called a urate crystal. It's because of the passage of uric acid from the mommy during pregnancy. Okay, and it's very common during the first few days of life. And so you have to do anything, just ensure that your baby has adequate breast milk, your baby passes enough urine. Okay, however, it could be associated with dehydration, right? If your baby doesn't pass too much of urine, or your baby lose a lot of weight, more than 10% within the first week of life, then together with this, then maybe it's like telling you that, okay, my child doesn't have enough breast milk, so I probably have to do something. Okay. Otherwise, this is a normal thing. A withdrawal bleed, sometimes you do get blood in the diapers during the first few days of life, especially in female babies. All right. So it's because of exposure of maternal hormone in utero. The mother's estrogen, mother's hormone is going to pass through the placenta, go to the baby. So your baby will have high estrogen level of female hormones. And they may have bleeding from the vagina. So what you need to do is check properly and make sure that blood is actually coming out from your baby's vagina, and just clean it. Okay. Sometimes it's also associated with enlarged breast in the babies, or we call it gynecomastia. Okay, so just check, and it's usually due to maternal hormone, and it will resolve by itself, so don't have to worry about this. So now the next question is, if there is no wee-wee within the first day of life, should we be worried? Answer is yes. Yes, yes, yes. Okay, so why are we worried? Because number one, it can be due to dehydration. But we all know that babies do not pass so much of urine during the first day of life. Okay, so why are we worried? We are worried a condition that we call a bladder outlet obstruction. Okay, means that there is an obstruction at the bladder that your baby cannot pass out the urine, especially in boys. Okay, so what you need to do, always during the first day of life, observe how your baby passes the urine. If your baby can shoot, the further the better. Okay, so this condition is what we call a posterior urethral valve. Usually it's seen in boys. Okay, and as you can see, this is on the left will be a normal urinary systems. You have kidneys and bladders, and at the end of the bladder you have the bladder neck. And on the right side, as you can see at the exit side of the bladder, there is a small membrane that is blocking the urine. So you can see on the second picture on the right, the bladder has become dilated and somewhat looks like a cauliflower, and all the urines are stuck in the bladder and flow upwards back into the kidney. So this is what we call reflux. Then the kidneys are going to be dilated. It's going to spoil the kidney. All right. This is what we call obstructive uropathy. Okay. So especially in boys, please make sure that your boys can pass urine and can shoot far. You should be grateful for that. You should be grateful for that if your baby can pass, shoot far. Okay. So this is called a posterior urethral valve. All right. So I think that's it for my talk. It's about 30 minutes. Okay. So take home message. Pay attention to the Poos and Pees. Use your senses. Look, smell it, or if you want, you can touch it. All right. And also the warning signs. So the warning signs for the poo will be the red notice. You remember the Netflix movie? The rock will be black in color, which is MALENA. Gal Gadot of Wonder Woman wears the rock is black. Wonder Woman wears the red one, which is any bleeding, and the white one will be Ryan Reynolds, which is a pale stool. Okay, which may indicate that your baby might have a biliary atresia. Okay, so for urine, basically it's more of dehydration, and another one will be the posterior urethral valve. Okay, so yeah, so with great power comes with great responsibility, in conjunction with our Spider-Man No Way Home, which is such a great movie. So we parents are the heroes to our children. As a parent, we are their heroes. We have a lot of responsibility. We need to educate ourselves. We try to learn as much as possible, educate ourselves regarding the baby's condition, so that we can provide them the best care. Okay, and we can, if we encounter something that we are not sure, or there are some danger signs, immediately bring to the doctor. Okay, so that's all for my talk. Thank you for your kind attention.
Thank you so much, Doctor, for that very, very interesting information that you shared with, especially for the new parents who are going to be welcoming their bundle of joy. There's some question we have received via our WhatsApp messenger earlier. Would you have the time, Doctor, to take some questions?
Yeah, sure. Wait, how do I go back to the? Wait, how do I go back? Oops.
Doctor, you just stop share screen.
Stop share screen.
Yeah.
Oh my God, where is it? Stop share screen.
On the below. I can stop for you. Doctor.
It's okay, Doctor. I will read up the questions.
Oh, okay. I saw already. Okay. Stop share screen. Okay, got it. All right.
The question is: if baby below 6 months gets diarrhea, what treatment can we apply at home?
It's quite normal for children to get diarrhea. Okay. The common. Okay. First, number one, when they have diarrhea, how do we know they are having diarrhea? Okay. So by definition, diarrhea is at least you must have three passage of loose stools per day, and they even calculate the weight, which is 500 grams, but that's okay. So as long as if you have more than 3 passage of loose stool, or if you, based on what I explained just now, Bristol 5 to 6 to 7, and so then you already established the diagnosis of a diarrhea. Number 2, you want to know if your baby is passing out a lot of stools, is your baby having dehydration? So if it's not too much, say maybe 3 to 4 5 times a day, and maybe Bristol 5, Bristol 6, not too bad. Your baby still can drink very well. Your baby stay very well hydrated. Then basically you don't have to be worried. Okay, you can just observe. If you're worried, you see that okay, your baby's loose stool is getting more and more frequent, then you probably want to consider buying certain products to actually reduce the frequency of the loose stool. Best is to be assessed by a doctor, doctor at the nearest clinic or the hospital. And because the only thing in diarrhea that we'll worry is dehydration. Okay, most of the diarrhea in children is due to virus, and they will kill by itself. But in certain conditions like bacteria, infective diarrhea, they probably need antibiotics. Okay, but most of it is due to rotavirus. Like recently, within the past 2 months, we have seen a lot of rotavirus in our clinic, and there's nothing you can do about it. Rotavirus, you just have to practice good hand hygiene. So yeah, it's very important for parents. If your child has diarrhea, you need to keep yourself safe. Every time you change your baby's diapers, please go wash your hands with soap. All right, don't change the diapers, put it over there and then touch your face, and then and then kiss your baby. So if you get it, you get an infection, you start to have a bit of loose stool, and your child recover from that, and you may spread the virus back to your child, and the child may become infected again. And once you recover, the child may spread back to you. So it's like a vicious cycle. So you have to be very careful about that. Yeah.
Okay, doctor, thank you. The other question will be, when my baby changes diet to solid food, will I see any changes in the poo?
Yes, definitely. Definitely you will see. All right, even from breastfeeding to formula fed, you already see your poo is actually getting more and more mushy and creamy. Like the ones that I show. All right, later you all can review back the videos. So especially if you start to have a porridge, also it's going to be a bit more hard. Yeah.
Okay. Okay, doctor. So thank you so much for your presentation today. If there's any more questions coming in, we will forward it to the marketing department so they can let you know as well. So any last words for parents who will be coming? I mean, most of the participants today, I think, are the first-time parents. First time they're going to welcome their bundle of joy. Any message to them?
Enjoy your parenthood. Parenthood is supposed to be fun. Okay. It's tiring. It's taxing. Don't worry. Okay. So try to learn. Sometimes it's good to follow this kind of a talk. You learn some basic things about your child, so you are not so nervous or anxious when you encounter certain conditions. Okay. So the more you know about your children, the better parents you could be. But anyway, enjoy your parenthood. It's supposed to be fun.
Thank you so much, doctor. We hope to see you.
All right. Thank you. Okay. Bye.
Bye. So thank you everyone for joining us today. We will be letting you know on the second question for today for the prize of the Pigeon Attractive goodie bag, which is been given by Pantai Ampang Hospital. You may like Pantai Ampang Hospital at Facebook page and answer the question there. The second question is, which is the type 6 poo of the poo family type? Which is the type 6 poo in the poo family type? We will mention that in the chat box as well. And the last question for the last prize of the Pigeon Go Mini Breast Pump is, how much does the Pigeon Go Mini Breast Pump Moto weighs? How much does the Pigeon Go Mini Breast Pump Moto weighs? And this question you may answer on our